Do you want to know how much time you truly have left once you pass 70? The truth is, your body sends subtle signals about your longevity, and some of the most surprising indicators aren't hidden in your DNA, but right in your mouth. More than just a smile, your oral health acts as a crucial, often ignored, predictor of your cardiovascular future. Medical research has uncovered compelling evidence that issues in your mouth are not isolated problems. They're deeply connected to your entire systemic health. We're talking about real patterns that researchers and doctors have observed, suggesting a strong correlation between conditions like gum disease and a higher risk of heart problems. In this video, we're going to talk about 5 signs in your teeth and gums that can reveal how your heart is truly faring after 70. By the end, you'll know exactly what to look for in your own oral health, and, more importantly, what actionable steps you can take to protect your heart. Stay tuned until the end, because recognizing these signs can empower you to add years of quality life. After 70, every year feels more precious, and your body's resilience changes. This makes every health signal, especially those from your mouth, even more critical. Oral issues, often dismissed as minor annoyances, can have a magnified systemic impact in older adults. Understanding these specific oral indicators is essential, as they offer a unique glimpse into your cardiovascular health, providing insights tailored to this vital life stage. Sign 1. Your persistent gum inflammation. One of the strongest indicators of how long your heart might keep beating strong after 70 isn't hidden in your blood pressure readings alone, or even your cholesterol levels. It's something far more visible, yet often overlooked: the health of your gums. Studies have consistently shown that people who struggle with ongoing gum inflammation, known as gingivitis or its more advanced form, periodontitis, tend to have a significantly higher risk of heart disease. That's because when your gums are chronically inflamed, they become an open pathway for bacteria to enter your bloodstream. Once there, these bacteria and the inflammation they cause can contribute to plaque buildup in your arteries, hardening them and straining your heart. It's a silent battle that starts in your mouth but can have profound consequences for your entire cardiovascular system. Think about 2 women, Eleanor and Martha, both 72 years old. Eleanor has always been diligent with her oral care. She brushes and flosses regularly, attends her dental checkups, and while she might occasionally notice a little pink when she brushes, it quickly resolves. Her gums are generally firm, pink, and her dentist confirms her oral health is excellent. Her heart health markers remain stable, and she enjoys an active life. Martha, on the other hand, often skips flossing and has noticed her gums bleed almost every time she brushes. She dismisses it as just aging or sensitive gums. What she doesn't realize is that her persistent bleeding isn't just an inconvenience, it's a constant source of inflammation. This chronic inflammation puts an ongoing strain on her body, and her doctors have started to note concerning changes in her cardiovascular health, including increased inflammation markers that directly link back to the condition of her mouth. A slow, steady decline in gum health isn't just about losing a tooth. It can signal underlying issues that affect your heart. So what should you look for? Pay close attention to these warning signs. Gums that are red, swollen, or tender to the touch. Gums that bleed easily when you brush or floss. Persistent bad breath that doesn't go away, even after brushing. Gums that appear to be pulling away from your teeth, making your teeth look longer. Or even new spaces developing between your teeth and teeth that feel loose. These aren't just minor annoyances. They are critical signals your body is sending. If you've noticed yourself experiencing any of these symptoms, don't ignore it. Your gums are your foundation, and when they start to show signs of trouble, so does your overall resilience, including that of your heart. The good news? Persistent gum inflammation is something you can absolutely improve, and by doing so, you can directly impact your heart health. The more you care for your gums, the stronger and healthier your entire body remains. If you've noticed any of the warning signs, start making small, consistent efforts to build better oral health habits. This means brushing thoroughly twice a day with a soft bristled brush, making daily flossing a non-negotiable part of your routine, and most importantly, maintaining regular dental checkups and professional cleanings. Your dentist can identify early signs of gum disease and provide targeted treatments that can halt its progression and reduce systemic inflammation. Don't wait for the problem to escalate. Take action now. Because, in the end, how well you protect your gums today can tell you a lot about how well you'll protect your heart and keep moving through life with vitality and confidence. So pay attention to your smile. It might just be the simplest way to check in on your longevity. Sign 2. Your tooth health. Believe it or not, the state of your teeth and gums can be a powerful predictor of your future heart health, especially once you're past 70. Many people dismiss missing teeth or pervasive decay as just a normal part of aging, but medical research tells a different story. Tooth loss often isn't merely cosmetic. It's frequently the culmination of chronic infection and inflammation that has been silently at work in your mouth for years. This ongoing infection, particularly from severe decay or gum disease that leads to tooth extraction, can unleash bacteria and inflammatory compounds into your bloodstream. Once in your system, these elements contribute to systemic inflammation, hardening of the arteries, and an increased risk of heart disease and stroke. Your teeth are not isolated. They are deeply integrated into your body's overall health system. Think about two individuals, Martha and George, both in their late 70s. Martha has always been diligent with her dental care, brushing and flossing regularly and attending her twice-yearly checkups. She has a full set of healthy teeth, free from significant decay or gum disease. Her heart health markers, including blood pressure and cholesterol, remain stable, reflecting her consistent attention to overall well-being. George, on the other hand, began to neglect his dental health a few years ago. He now has several missing teeth, and those remaining show signs of advanced decay and chronic infection. He often experiences discomfort, and his diet has suffered due to difficulty chewing. What George doesn't realize is that the chronic inflammation originating from his decaying teeth and gums is contributing to a silent, steady decline in his cardiovascular health, making him more susceptible to heart-related issues. Martha's proactive approach suggests her body is still functioning optimally, while George's oral health struggles could be a warning sign for his heart. So what should you be looking for? Significant tooth decay or impending tooth loss isn't just about a cavity or a wiggly tooth. It can manifest as persistent pain, sensitivity to hot or cold, visible holes or dark spots on your teeth, or even chronic bad breath that doesn't go away. You might notice your teeth feeling loose or experience discomfort when chewing. These are not minor inconveniences to be ignored. They are potential red flags, signaling that your oral environment is compromised and that impact can extend far beyond your mouth. Your body is giving you signals, and when your teeth and gums are struggling, it often indicates a broader challenge to your systemic health. If you've noticed any of these signs, it's time to pay close attention. The good news is that tooth loss and decay are largely preventable and treatable. You have the power to protect your smile and, by extension, your heart. Consistent oral hygiene is paramount. Brush twice daily with a fluoride toothpaste, floss every day to remove trapped food and plaque, and don't skip your regular dental checkups and professional cleanings. These routine visits are crucial for identifying and addressing decay or gum issues before they escalate. Discuss with your dentist about fluoride treatments or sealants if appropriate. Additionally, making mindful diet adjustments, such as reducing sugary snacks and drinks, can significantly reduce your risk of decay. Taking these simple, proactive steps can help maintain your natural teeth, reduce systemic inflammation, and support a healthier heart for years to come. Because in the end, how well you preserve your smile today can tell you a lot about how strong and healthy your heart will stay in the years ahead. Beyond the familiar feeling of thirst, there's a more persistent, often dismissed sensation that could be a significant indicator of your broader health. Chronic dry mouth. Known medically as xerostomia, this isn't just an inconvenience. It's your mouth's way of telling you something deeper might be amiss, with implications even for your heart. Saliva is your mouth's natural protector, constantly washing away food particles and bacteria, neutralizing acids, and remineralizing tooth enamel. When its flow significantly reduces, your mouth becomes an arid landscape, a breeding ground for problems. This lack of natural defense leads to accelerated tooth decay and severe gum disease. Research consistently shows that chronic oral inflammation, exacerbated by dry mouth, can contribute to systemic inflammation throughout your body, putting extra strain on your cardiovascular system and increasing your risk of heart conditions. It's a seemingly minor discomfort that can be a strong predictor of broader health issues you might be overlooking. Imagine two individuals, Arthur and Clara, both in their early 70s. Arthur has always been diligent about staying hydrated, and his mouth feels comfortably moist. He rarely experiences cavities, and his gums remain pink and healthy, a testament to his body's natural defenses working well. His heart health markers, as consistently observed by his doctors, remain stable. Clara, on the other hand, has been experiencing a persistent dry, sticky feeling in her mouth for years. She dismisses it as just aging or a side effect of her medications, often forgetting to sip water throughout the day. This arid environment in her mouth has led to recurring cavities, irritated gums, and even difficulty chewing certain foods. What Clara doesn't realize is that her chronic dry mouth isn't just an oral issue. It's a silent contributor to a higher bacterial load and inflammation in her body, subtly increasing the burden on her heart. The contrast between Arthur's lubricated path and Clara's arid landscape illustrates how vital saliva is, not just for a healthy smile, but for a healthier heart over time. So, is your mouth trying to tell you something? It's crucial to recognize the specific symptoms of chronic dry mouth that warrant attention. Beyond just feeling thirsty, look for signs like a persistent sticky, dry sensation in your mouth, difficulty swallowing or speaking, a burning feeling in your mouth or on your tongue, noticeably cracked lips, or a rough, dry tongue. You might also experience frequent thirst, changes in your sense of taste, or even chronic bad breath that doesn't go away. These aren't just minor annoyances, they can be warning signs. Chronic dry mouth is often a side effect of various medications common among older adults, but it can also signal underlying health conditions like diabetes, autoimmune disorders, or even certain neurological issues. If you notice these symptoms, especially if they're persistent or worsening, don't ignore them. They are your body's way of communicating that it needs support, and understanding their cause can have indirect but significant positive impacts on your heart health. The good news is that chronic dry mouth is often manageable, and addressing it can significantly improve your oral health and, by extension, support your heart. Simple, actionable steps can make a huge difference. Start by increasing your water intake throughout the day, sipping frequently rather than gulping. Chewing sugar-free gum or sucking on sugar-free candies can stimulate saliva flow. Over-the-counter saliva substitutes, available as sprays or gels, can also provide relief. Most importantly, if you suspect your dry mouth is linked to medication, talk to your doctor. Never stop taking prescribed medication without professional guidance, but your doctor may be able to adjust dosages or suggest alternative medications with fewer dry mouth side effects. Regular dental checkups are also vital to manage any increased risk of decay or gum disease that dry mouth can cause. By actively managing dry mouth, you're not just making your mouth more comfortable, you're reducing inflammation, supporting your oral microbiome, and taking a proactive step toward a healthier, stronger heart. Because hydrating for health today can lead to a more comfortable and resilient future for years to come. When your mouth signals distress through persistent pain or acute infection, it's not merely a local inconvenience. It's an urgent warning that echoes throughout your entire body, especially to your heart. Sign 4. Persistent oral pain and infections like abscesses are among the most critical indicators you cannot afford to ignore. These are not minor discomforts to be brushed aside as just another part of aging. Research shows that untreated oral infections can unleash a cascade of bacteria and inflammatory substances directly into your bloodstream. Once in circulation, these invaders can contribute to systemic inflammation, strain your cardiovascular system, and significantly raise your risk for serious heart conditions, including endocarditis, stroke, and heart attack. This is a direct and immediate danger, not a slow decline. Think about two scenarios. Consider someone who, at 72, develops a painful, throbbing toothache accompanied by swelling. They immediately contact their dentist, recognizing the severity of the symptoms. Prompt professional intervention, perhaps a root canal or extraction, resolves the infection swiftly, preventing bacteria from spreading and minimizing the inflammatory load on their heart. Their proactive choice helps maintain their cardiovascular stability. Now imagine another individual, also 72, experiencing similar severe oral pain. They dismiss it, hoping it will simply go away, perhaps resorting to over-the-counter pain relievers. As days turn into weeks, the infection festers, quietly releasing bacteria and inflammatory markers into their system. This unchecked bacterial assault can exacerbate existing heart conditions or even initiate new ones, potentially leading to an emergency room visit for complications that could have been avoided with timely dental care. Ignoring the ache isn't just about enduring pain. It's about risking your heart's very future. So, how do you know when oral pain is more than just a minor nuisance? It's time to act immediately if you experience severe, throbbing pain that doesn't subside, especially if it worsens when you lie down or chew. Look for swelling in your gums, face, or neck. A fever, pus draining from around a tooth, or difficulty opening your mouth fully are all urgent red flags signaling a serious infection, such as an abscess. These aren't just uncomfortable symptoms. They are your body's critical alarm system, signaling that professional care is needed without delay. Do not wait for these signs to worsen. Your body is telling you something that requires immediate attention. The good news is that when it comes to oral pain and infections, you have the power to act decisively. If you notice any of these urgent symptoms, the most crucial step is to seek professional dental care immediately. Don't delay, don't try to self-medicate, and don't dismiss it as just a toothache. Prompt dental intervention, whether it's an antibiotic prescription, a root canal, or extraction, can quickly eliminate the source of infection, reduce inflammation throughout your body, and significantly mitigate the risk of adverse effects on your heart. Early action is truly key to preventing systemic complications. By addressing oral infections swiftly and effectively, you're not just saving a tooth, you're actively protecting your heart and ensuring a stronger, healthier future. Because how quickly you respond to oral pain today might just determine how well your heart keeps beating in the years to come. Sign 5. Your changes in taste or smell. After 70, many people notice a subtle decline in their senses, and that's often a natural part of aging. But what if those changes are more significant, or even sudden? Your ability to taste and smell isn't just about enjoying a meal. It's a crucial part of your body's intricate health report. When these senses shift dramatically, it can signal underlying issues like nutrient deficiencies, medication side effects, or even neurological changes that impact your entire system. These aren't isolated quirks. They are subtle but powerful indicators, connected to the very factors that influence your cardiovascular health. Pay attention to these shifts, as they can offer a glimpse into your future well-being. Think about two people, Mary and George, both in their early 70s. Mary still delights in the aroma of freshly brewed coffee and savors the distinct flavors of her home-cooked meals. Her intact senses encourage her to eat a varied, nutrient-rich diet, full of fresh fruits, vegetables, and lean proteins, all of which directly support her heart health. George, on the other hand, has noticed his food tastes bland or even metallic. He's lost interest in cooking, often opting for processed foods because they offer a stronger, albeit artificial, flavor, or simply because eating has become a chore. This decline in his senses not only affects his enjoyment of life, but can lead to poor nutritional intake, subtle deficiencies, and an increased reliance on unhealthy options, putting an unseen strain on his cardiovascular system over time. So, how do you know if your sensory changes are more than just aging? It's time to pay attention if you experience a persistent metallic or bitter taste in your mouth, a sudden or significant loss of your sense of smell, or if foods you once loved now taste off or unappetizing. Other warning signs include a burning sensation in your mouth without an obvious cause, or a constant feeling of food being bland even after adding seasoning. These aren't just minor inconveniences. They can be your body's way of signaling deeper issues. If you notice yourself making different food choices simply because things no longer taste or smell the same, it's a red flag. The good news is that understanding these sensory changes can lead to important health improvements. If you've noticed persistent or sudden shifts in your taste or smell, don't ignore it. The first step is to consult your doctor. They can help determine if it's a side effect of medication, a nutrient deficiency, or another underlying health condition that needs attention. Reviewing your medications with your doctor is crucial, as many can impact these senses. Focus on nutrient-dense foods to ensure your body is getting the support it needs, even if you're finding it harder to enjoy meals. Experiment with different textures and natural seasonings to make eating more appealing. Because identifying and addressing the causes of these changes can significantly improve your quality of life, ensure proper nutrition, and ultimately contribute to a healthier, stronger heart for the years ahead. Now that you know these 5 crucial signs from your teeth and gums, take a moment to reflect on where you stand. We've explored persistent gum inflammation, tooth loss and decay, chronic dry mouth, oral pain and infections, and even subtle changes in taste or smell. These aren't isolated issues. They are interconnected indicators, your body's way of telling you about your overall health, and importantly, your heart's future after 70. The good news is that most of these factors are within your control. Your future isn't set in stone, and the choices you make today can have a powerful impact on how many years you have ahead of you, and the quality of those years. Recognizing these warning signs is the first step, but acting on them is where true empowerment lies. You have the ability to transform this knowledge into real, lasting health improvements. If you've recognized areas where you need to improve, don't wait. Start now. Prioritize regular dental checkups and cleanings. Maintain consistent brushing and flossing, and pay attention to any persistent changes in your mouth. Discuss any concerns about dry mouth or sensory shifts with your doctor or dentist. The goal isn't just to live longer, it's to live better, ensuring the quality of life you experience in those years is vibrant and full. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned and how you plan to use it in your life. Your thoughts are important to us. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you.